Hi, madam. We can see you. We can see you, madam. Madam, you on mute.
That's great.
Madam, you on
Can you
mute.
hear me now?
Yeah, I can hear you.
Right.
Sorry, madam. I think something went wrong. Can we
Now?
good to go? Yeah, we are
Yes,
perfect. Yes.
we can start
Uh,
now.
yeah,
Your
Shiraz, you can start.
So, good evening, everyone. So, I am Shiraz, working as Senior Business Manager at Slim Pharmaceuticals Private Limited. Welcome to the World Pharmacist Day celebration organized by Slim Pharmaceuticals Private Limited. Today, we had an eminent speaker, Professor Nitoshi Samaranayake, where she will be delivering her lecture on good dispensing practices. As you know, Slim Pharmaceuticals was established in 2011, and Slim Pharmaceuticals has played a pivotal role in shaping up the Sri Lanka pharma industry. Slim Pharmaceutical houses Roche, Switzerland, Baxter, United States, Billion Pharmaceuticals, Turkey, ADM Protection, UK, Troika Pharmaceuticals, India, Pavia Pharmaceuticals, Italy, Gufic Biosciences, India, and having prominent products in leading therapeutic classes. As Slim Pharmaceuticals always want to educate our stakeholders, this is one such program that will be add value to you. And also, I would like to make a special announcement. So after the lecture, we have organized a special quiz competition. So the first three participants who gives the correct answer will be eligible to win a special gift. And also, after the lecture, there will be an Q&A session. So you can forward all your questions to the chat box. And in the Q&A session, we can accordingly raise up the questions. To begin with, let me introduce our eminent speaker. Professor Nitoshi Samaranayake is a professor in the Department of Pharmacy and Pharmaceutical Sciences, Faculty of Allied Health Sciences, University of Sri Jayewardenepura. She obtained her BSc Special Degree in Pharmacy from the University of Colombo with a first class honors in 2004. She pursued her postgraduate education in Hong Kong, where she completed her PhD in medication safety at the Division of Clinical Pharmacology, Department of Medicine, Faculty of Medicine, the University of Hong Kong in 2013.
This call is now being recorded.
She has been a pharmacy educator in the University of Sri Jayewardenepura since 2009 and has a keen interest in training and research activities related to medication safety. She has published 35 full paper publications of She later contributed as editor-in-chief from 2016 to 2020. She is currently serving in the editorial board of the Pharmaceutical Journal of Sri Lanka and as the editor-in-chief of the Journal of Health Sciences and Innovation, published by the Faculty of Allied Health Sciences, University of Sri Jayewardenepura. She is an editorial member of the Sri Lanka Journal of Health Research, published by the Ministry of Health as well. Professor Samaranayake has also contributed as reviewer to many international journals, including the European Journal of Hospital Pharmacy, Informatics for Social and Healthcare, International Journal for Quality in Healthcare, Journal of Clinical Dentistry, and the Postgraduate Medical Journal. She has extended her honorary services to the National Medicine Regulatory Authority in the past, where she served as a member of the Medicines Evaluation Committee over 2.5 years and a board member of the NMRA for nearly 3 years, starting from July 2018. She has a keen interest in developing the pharmacy workforce in Sri Lanka, especially in establishing clinical pharmacy services in Sri Lanka. Since 2010, she has been engaged in organizing a number of training programs in clinical pharmacy for academics and graduate hospital pharmacists in Sri Lanka, and intends to develop a network of hospital and academic pharmacists in clinical pharmacy with close mentoring. Welcome, Madam. Thank you for accepting our invitation. The floor is open for you. Thank you.
Thank you very much for that extensive description of my profile. First, like to thank Mr. Kazim, Riza Kazim, CEO of Slim Pharmaceuticals, for inviting me for this talk today. And I'm extremely honored that I am being able to talk to and be a part of such a large community of pharmacists joining today. So it's the World Pharmacist Day, and so I think it's a day that we should celebrate our efforts in giving our services to our society. So today I would like to dedicate some time together with you all to discuss some facts about improving our services and improving our dispensing practices and giving it to back to our society to ensure that medicines are used without harm by patients. So let me now start the lecture on good dispensing practices, which I'm sure you all are all familiar with, but we will try to enhance our knowledge and skills on our dispensing practices, hopefully within the next half hour. Can I see my slides, please? Right, next slide. Right, so the first thing that I'd like to emphasize before I start is our role as pharmacists. So maybe we have in the audience, it's a large audience, so I might not be able to talk to each of you, but I'm sure we have hospital pharmacists joining us, community pharmacists joining us, and other pharmacists joining us as well. So the idea among most in the society and among most is that a pharmacist is there to dispense medicines. And dispensing medicines has a very broad definition. However, most think that dispensing medicines would be reading a prescription and finding the medications according to the prescription and giving it back to the patient is what is meant by dispensing. But what I want to emphasize in today's talk is that that is just only a mere part of our duty. But as a pharmacist, as the pharmacist who has been professionally trained for being an expert in medicines. We are there to make sure medicines are used without harm. So medication, if you take a tablet, you may recall that in the past, that even a paracetamol tablet was able to kill patients. So a young child was killed or rather died because of improper use of paracetamol due to a miscommunication in the label that was sent to the mother. So if you take a medicine, it's like a double-edged sword. That means if you use it carefully, you can benefit from it. But if you use it inappropriately, there can be harm. So pharmacists are there to make sure medicines are supplied to patients and they are used in a responsible way in order to benefit the society. So let's see how we can do that in our next slide. So,
since there's a technical issue, I can share the PowerPoint presentation. Madam, is it okay?
Yes, please, because
Okay.
I would require that.
Yeah, okay. I'll give me a 1 minute.
So until she puts the slides back, because there was a better picture of the dispensing cycle. I'm sure all of you are familiar with the dispensing cycle. So in the dispensing cycle, so shall we put it like this? So yeah, and then play the slide.
Now you can see the
I
slide now.
can't see, but if you can put the presentation mode, that would be better for me.
Okay, madam.
Now,
Wait.
yeah. Yeah. Right at the bottom.
Can you see the full screen, madam?
Yes. Okay, let's continue that. It's in the interest of time. So what you have in front of you is the dispensing cycle. I'm sure all of you know what a dispensing cycle is. The first point is to receive the prescription, then to do a preliminary prescription review, prepare the medicines and label the medicines accordingly, record and billing, double checking and handing over the medicines with after educating the patient. That is the usual process. But if you take each one of them, we will be able to discuss what are the most important aspects that has to be addressed when we are dispensing medicines. Next slide. So as a pharmacist, receiving the prescription is an extremely important aspect. Before that, I would like to ask, are you going to do Tamil translations? Should I stop when? May I know how you plan to do the Tamil translations?
Good evening, madam.
Yeah. Will you be doing the Tamil translations, or how should I go slide by slide?
Madam, if you go that every slide, it will be better, no, madam.
Right. Okay. So how about you explain what I mentioned up to now, and then from here onwards, I will take you one slide by slide.
Sure, madam. From the first slide, madam, I can go ahead. No.
Yeah.
Okay. எல்லாருக்கும் இரவு வணக்கங்கள். இன்றைய நாள் வந்துட்டு எங்களுடைய நாள் வந்துட்டு பார்மசியினுடைய ஒரு தினம், அதாவது உலக தினமாக இருக்கின்றது. அதை குறித்தான் இந்த நிகழ்வு இன்று நாங்கள் செய்திருக்கின்றோம். அதிலே முதலாவது விஷயம் இன்று இந்த நாளை நாங்கள் சொல்ல வருவது என்னன்னு சொன்னால், அதாவது ஒரு மெடிசின்ஸ், அதாவது நாங்கள் வந்து எங்களது மருந்துகளை எவ்வாறு நாங்கள் விநியோகிக்க வேண்டும். எங்களது பார்மசிகளிலே நாங்கள் ப்ரெசிஷன், அதாவது வைத்தியருடைய சிட்டுகள் வருகின்ற போது அதை எவ்வாறான முறையில் நாங்கள் பிழைகள் இல்லாமல் நாங்கள் அதை வந்துட்டு விநியோகிக்க வேண்டும் என்பதற்கான அடிப்படையாக தலையங்கம் அமைந்திருக்கின்றது. அதிலே முதலாவது வந்துட்டு முதலாவது சர்க்கிளுடைய அதில் வந்துட்டு போட்டிருக்கிறார்கள். அந்த சர்க்கிளில் முதலாவது டாக்டருடைய ப்ரெசிஷன், அதாவது ஒரு வைத்தியருடைய ப்ரெசிஷன் வருகின்ற போது முதலாவது நாங்கள் ப்ரெசிஷனை ரிசீவ் பண்ண வேண்டும். அதாவது அதை எடுத்து இரண்டாவது அந்த ப்ரெசிஷனுக்கு உரியவாறு அதை என்ன செய்வோம், நாங்கள் தேர்வு செய்ய வேண்டும். அந்த தேர்வு செய்ய அந்த ப்ரெசிஷன்லேயே, அதாவது அந்த மருந்து சிற்றிலே உள்ள மருந்துகளை நாங்கள் வேறு வேறாக வந்துட்டு பகிர்வு செய்து அதை விநியோகத்துக்கு தகுந்தவாறு நாங்கள் அதை தயார்படுத்த வேண்டும். அதன் பிறகு அந்த மருந்துகள் என்ன நோக்கம், அதாவது எவ்வாறு எழுதப்பட்டிருக்கின்றது, அதனுடைய மில்லிகிராம் அதனுடைய ஜெனரிக், அதாவது பொதுவான நேம் அது சரியாக இருக்கின்றதா என்பதை, அதை பிராண்ட் நேமும் அந்த ஜெனரிக் நேமும் சரியாக இருக்கா என்பதை வந்துட்டு நாங்கள் பார்த்து அந்த ரெக்கார்ட், அதாவது எங்களுக்கு புக்லி, அதாவது இப்பொழுது என்ன மாதிரியான வந்துட்டு அறிவிக்கப்பட்டிருக்கின்றது, மருந்துகள் வந்துட்டு பதிவு செய்யப்பட வேண்டும். அதாவது என்ன பேஷனுக்கு எந்த வைத்தியரால் எழுதப்பட்டிருக்கிறது அந்த ரெக்கார்டுகளை வந்துட்டு நாங்கள் அதில் பதிவு. அதை மீண்டும் இரண்டாம் தரம் டபுள் செக்கிங், அதாவது இரண்டாம் தரம் வந்துட்டு நாங்கள் அதை மீண்டும் செக் பண்ண வேண்டும். பிறகு தான் அந்த மெடிசின், அந்த மருந்துகளை உரிய பேஷனிடம், அதாவது நோயாளியிடம் அதை நாங்கள் கொடுக்க வேண்டும். அதுதான் இது முதலாவது எங்களுடைய அந்த ஸ்லைட்லேயே உள்ள dispensing cycle என்கிறதுக்கான அந்த வட்டம் மட்டும் காட்டப்பட்டிருக்கின்ற விடயமாகும். Madam, you can go ahead, madam.
Yes. So the dispensing cycle I mentioned, you have seen in the previous slides, the dispensing is the first point of the point of care in the dispensing cycle is to receive the prescription. And I think you might think that that is a very simple task and anybody can do this task. What is it? It's really not difficult. It's just to receive a prescription. But this is actually one of the most important steps in your dispensing cycle. And the good dispensing practices specify that this step should be done by a registered pharmacist and not anybody else. So if you are going to
இரண்டாவது சொல்லப்பட்டிருக்கின்றது patients, அதாவது patients யார், அந்த patients யார், sorry.
So if you're going to have a trainee or a non-pharmacist receive a prescription at a pharmacist, that is not appropriate. It has to be at least under the supervision of a pharmacist. Now, why do I say that? Because this is a very important step where you identify the patient, right? Now, if it was a simple job that is required from a pharmacist, that is to receive a prescription, read what the medicines are, and prepare it and give it, then it is not a big deal. But now our role, our actual role of a pharmacist is to make sure the patients receive their appropriate medicines and they use the medicines appropriately without harm. So for that purpose, you have to know who your patient is. So this is not only in the hospital. It can be in the hospital, it can be in the community pharmacy. But when you receive a prescription, you have to verify who your patient is. Because especially in the community pharmacy, it might be the patient who comes with the prescription. It might be another caregiver who comes with the prescription. Or it might be just a messenger with money who has come with the prescription. So there's, for us to give that service to that patient, we have to ensure who is in front of us first, right? So ideally it should be the patient or the caregiver, so that we can ask the patient, who verify whether the patient is there, and then ask or know at least what is their condition. because very often there are instances where we give the wrong medicine. We're reading reading the medicines wrong, but if we know what their disease conditions are and what their other medications that they are taking, we could ensure those mistakes are not does not happen. For example, sometimes patients bring prescriptions with asking for Panadine when they're already taking paracetamol, right? So if you have asked the patient, what are the other medicines you're taking, you will be able to stop those kind of duplications. And the patient taking the same medicine from two places. So therefore, we have to verify who has come in front of us, the patient or the caregiver or anybody else. Try to find out what their actual disease problem is and their other problems. Try to find out if they are taking any other medications that could that would interact with these medicines that you are going to dispense to this patient, and find out whether the patient has any allergic conditions to drugs or food. So that is one of the first steps you must do when you're dispensing medicines to a patient. Translation.
இரண்டாவது விடயம் வந்துட்டு நீங்க பேஷண்ட்ஸை எவ்வாறு நீங்கள் தெரிந்து கொள்ள வேண்டும், அதாவது ஐடென்டிஃபை பண்ண கொள்ள வேண்டும். அதுக்கான காரணம் முதலாவதாக மேடம் சொல்லுறாங்க, அந்த பேஷண்ட் நோயை நீங்கள் தெரிந்து கொண்டால் அவருக்கான சரியான மருந்துகளை விநியோகிப்பதற்கு உங்களுக்கு ஒன்று பார்மசிஸ்ட், அதாவது எங்களது பார்மசி நிறுவனங்கள் பார்மசிகளுக்கு ரெஜிஸ்டர் பண்ணப்பட்டிருக்கிற பார்மசிஸ்ட் வந்து கட்டாயம் இருக்க வேண்டும். அல்லது தவிர்க்க முடியாத காரணங்கள் வருகின்ற போது அவரால், அதாவது பயிற்சி அளிக்கப்பட்ட, நன்றாக பயிற்சி அளிக்கப்பட்ட ஒரு நபர் அந்த
Next slide, please.
Madam, just excuse. There are some request has come. If possible,
அறிந்து கொள்ள வேண்டும். அதுக்கான காரணம் சில நேரங்களில் எங்களுக்கு வருகின்ற சிட்டுகளில் சில, அதாவது சில மருந்துகளினுடைய பிரயாணங்கள் எங்களுக்கு தெரியாமல் இருக்கிறது. எங்களுக்கு அதை அறிந்து கொள்வது மிகவும் கஷ்டமாக இருக்கும். அதனால் தான் அந்த பேஷண்ட்க்கு, அந்த நோயாளியினுடைய நோய் எவ்வாறான நோய் என்பதை கூட நாங்கள் தெரிந்து கொண்டால் அது எங்களுக்கு இலகுவாக்கும் அவர்களுக்கு வழங்க மருந்து. அதுவே உதாரணமாக அந்த பேஷண்ட் ஏற்கனவே இருந்தால் இப்போது அவருக்கு வந்து பரிந்துரைக்கப்பட்டிருந்தால் அவருக்கு நீங்கள் தெளிவாக அறிவூட்ட முடியும். ஏற்கனவே நீங்கள் பாராசிட்டமால் எடுப்பதனால் இதை நீங்கள் தவிர்த்துக் கொள்ள வேண்டும். அப்ப அதன் போது அந்த பேஷனுடைய நன்மைகள் அங்கு கவனிக்கப்படுகின்றது. அதே போல் அவருக்கு எழுதப்பட்டிருக்கிற சில மருந்துகள் ஆனால் அந்த பேஷனுக்கு அலர்ஜி, அதாவது அந்த ஒவ்வாமை, அந்த மருந்து அந்த
Mr. Riza, did you have any?
Yes, Madam. Madam, you can go with the 4 slides, then to explain.
Okay.
Right.
Okay.
And 4 slides and explain, relay. And also, Madam, there are some requests has come whether you can use a bit of English as well.
English. Singlish.
Singlish, yes.
Singlish. I can talk in Sinhala also if they want.
Yes, Madam, yes. Yeah.
Right, okay. So, right. So, I can talk in Sinhala as well. So, let me translate this. So, api දැන් ඇත්තටම බෙහෙතක් කියන්නේ දෙපැත්ත කැපෙන දැලිපිහියක් වගේ. නේ? ඒත් කියන්නේ අපි බෙහෙතක් හරි විදිහට පාවිච්චි කරොත් අපිට එකෙන් ගොඩාක් ප්‍රයෝජනයක් ලබා ගන්න පුළුවන්, බෙනිෆිට් එකක් ලබා ගන්න පුළුවන්. හැබැයි බෙහෙතක් වැරදි විදිහට පාවිච්චි කරොත් එකෙන් වෙන්නේ හානියක් patients ලට. එතකොට අපි pharmacist කෙනෙක් ඉන්නේ prescription එකක් වට්ටෝරුවක් විදිහට අරගෙන ඒක කියවලා බෙහෙත හොයාගෙන ඒක patient දෙන එක පමණක් නෙවෙයි. ඇත්තටම ඒක නෙවෙයි අපේ කාර්යභාරය. අපේ කාර්යභාරය වෙන්නේ අපේ ඒක කොටසක්. ඒ කියන්නේ වට්ටෝරුව ප්‍රිස්ක්‍රිප්ෂන් එක කියවලා බෙහෙතක් හරියට ප්‍රිපෙයාර් කරලා patient දීලා ඒක patient හරියට ඒ කියන්නේ වරදක් නොවන විදිහට, ඒ කියන්නේ harm එකක් නොවන විදිහට පාවිච්චි කරන්න උපදෙස් දෙන එක තමයි. ඒ කියන්නේ harm එකක් නොවන විදිහට අපි වග බලා ගැනීම තමයි අපගේ පරම කාර්යය. ඒකින්ද මේ dispensing cycle එක කරනකොට ඒ dispensing cycle එක කියන්නේ එච්චර සුළුපටු දෙයක් නෙමෙයි. අපි ඇත්තටම ලොකු responsibility එකක් තියෙනවා මේ medication එකක් dispense කරනකොට. දැන් මම ඉස්සෙල්ලා කිව්වේ පළවෙනි step එක තමයි අපිට prescription එකක් receive කරන එක. ඒ කියන්නේ prescription එකක් අතට ලබා ගන්න එක. ඒක pharmacist කෙනෙක් නොවන කෙනෙක්ට කරන්න එපා කියන එක තමයි good dispensing practices වල අපිට සඳහන් කරන්නේ. ඒ කියන්නේ අඩුම ගානේ ආ ට්‍රේනින් කෙනෙක් ඒකට පාවිච්චි කරනවා නම් හරි pharmacy assistant කෙනෙක් පාවිච්චි කරනවා නම් pharmacist කෙනෙක් එතන ඉන්න ඕනේ. ඒ මොකද එතනදී තමයි අපි ගොඩාක් තක්සේරුවක් කරන්නේ අපි ඉස්සරහා ඉන්න patient හරි caregiver හරි කවුද කියන එක. අපි තක්සේරුවක් කරන්න ඕනේ. එතකොට අපි මේ ඉන්නේ patient මේ ඉන්නේ caregiverද එහෙම නැත්නම් කවුරු හරි messenger කෙනෙක්ද පණිවිඩකරුවෙක්ද මේ ඇවිල්ලා ඉන්නේ කියන එක අපි ඉස්සෙල්ලා දැනගන්න ඕනේ. මොකද අපි කරන සර්විස් එක අපි යාට දෙන්නේ ඒගොල්ලන්ගේ තියෙන තේරුම් ගැනීමේ හැකියාව මත. අපි ඒක අඩු වැඩි කරන්න ඕනේ. ඊට පස්සේ අපි දැනගන්න ඕනේ ඇයි ඒගොල්ලන් මෙතනට ආවේ කියන එක. ගොඩක් වෙලාවට අපි ඒගේ රෝගය අහන්නෙත් නැහැ. ප්‍රිස්ක්‍රිප්ෂන් එකේ රෝගය ලියලත් නැහැ. හැබැයි ගොඩක් patientsලා ඒගොල්ලන් long term medicines ගන්නකොට ඒගොල්ලන් දැනුවත්. ඒගොල්ලන්ගේ මොනවාද තියෙන ප්‍රශ්න කියන එක. එතකොට ඒ රෝග තත්ත්ව සහ ඒගොල්ලන් ගන්න තවත් medicines තියෙනවා නම් ඒවා ගැන හොයා දැනගැනීමෙන් ඕගොල්ලන්ට medicine හින්දා වෙන ලොකු හානි අඩු කරගන්න පුළුවන්. මොකද ගොඩක් වෙලාවට අපි දැකලා තියෙනවා patientsලා එනවා ඒගොල්ලන් එක තැනකින් නෙවෙයි මෙඩිසින් ගන්න. ක්ලිනික් කීපයකින් මෙඩිසින් ගන්න. හොස්පිටල් එකක හොස්පිටල් ෆාමසිස්ට්ලා නම් ඕගොල්ලන් හොයලා බැලුවොත් ඕගොල්ලන්ට තේරෙයි ක්ලිනික් කීපයකින්ම එකම මෙඩිසින් එක දෙනවා. එතකොට ඒ වගේම අපි සුළු දේවල් ඔය පැනඩීන් පැරසිටමෝල් වගේ දේවල් ඒගොල්ලන් ඩුප්ලිකේට් කරනවා. එන්නේ ඒ වගේ දේවල් හොයාගන්න අවශ්‍ය නම් අපි patient වෙන හානිය වළක්ව ගන්න ඕන නම් අපි ඉස්සෙල්ලාම අසා දැනගන්න ඕනේ මොනවාද ඒගොල්ලන්ට තියෙන ප්‍රශ්න සහ මොනවත් තව මෙඩිසින්ස් ඒගොල්ලන් ගන්නවද කියන එක. හරි? එතකොට ඒක තමයි පළවෙනිම dispensing cycle එකේ පළවෙනිම important step එක. දෙවෙනි step එක තමයි මම මේ කියලා තියෙන්නේ preliminary prescription review කියන එක. දෙවෙනියට ඔයාලට පේනවා preliminary prescription review කියන්නේ මොකක්ද කියන එක. අපි බලමු preliminary prescription review එකක් කියන්නේ මොකක්ද කියලා. Next slide please. Stop me when you want to do the Tamil translation, right? Please.
So, madam, we'll go for 5 slides and do it after that.
Yeah, and you let me know when you have to stop me. So,
Sure, madam.
so a preliminary prescription review is the second important step. So we call this a preliminary review because this is not a clinical review. A clinical review is done. Clinical review එකක් කියන එක අපි කරන්නේ මීට වඩා ගොඩාක් බැරෑරුම් විදියට. හැබැයි අපි hospital එකක clinic එකක හරි clinic pharmacy එකක හරි community pharmacy එකක හරි ඉඳගෙන prescription එකක් අපි dispense කරනවා නම් අපිට අඩුම ගානේ කරන්න පුළුවන් check කරන්න පුළුවන් කරුණු තුනක් තියෙනවා. එකක් තමයි legality of the prescription, දෙක තමයි completeness of the prescription, තුන තමයි appropriateness of the prescription. හරි? මේ තුන මොකක්ද අපි බලන්නේ මේ මොනවද මේවෙන් check. එතකොට අපි මේවා prescription checks කියලා කියනවා. එතකොට ඕගොල්ලන් සාමාන්‍යයෙන් prescription එකක් අරගෙන මොනවද තියෙන medicines ටික මේවා තමයි තියෙන්නේ කියලා දෙන්න කලින් මෙන්න මේ තුන මොනවද කියන එක හරියට දැනගෙන check කරලා ඒ වැඩේ කරනවා. Next slide. එතකොට legality of a prescription කියලා කියන්නේ අපි හරියට බලනවා ඕගොල්ලන්ට ගෙනල්ලා දීලා තියෙන prescription එක legal prescription එකක්ද කියලා. සාමාන්‍යයෙන් hospital වල නම් private hospital වල නම් ඒක state hospital එකක් නම් government hospital එකක් නම් සාමාන්‍යයෙන් අපිට illegal prescriptions යන අඩුයි. නමුත් private hospital එකක හරි community pharmacy එකක හරි එන prescription එක legal prescription එකක්ද කියන එක verify කරන එක ඔයගලගේ පළවෙනි කාර්යභාරය. ඒකට අපිට බලන්න පුළුවන් එකක් date එක. ඒ මොකද මිනිස්සු දැනුවත්ව හෝ නොදැනුවත්ව සමහර වෙලාවට prescriptions පාවිච්චි කරනවා ගොඩාක් පරණ prescriptions. අපි දන්නවා දැන් අපිට patients ලා එක්ක අපි වැඩ කරනකොට අපිට තේරෙනවා අවුරුදු 10 විතර එකම බෙහෙත් වට්ටෝරුව පාවිච්චි කරනවා ડોක්ටර් කෙනෙක් හම්බ වෙන්නේ නැතුව එකම දිගට. ෆාමසිස්ටුත් ඒ මෙඩිසින්ස් ඒ විදිහටම හැමදාමත් දීලා. හැබැයි ඒක එහෙම වෙන්න විදිහක් නැහැ. මොකද ගොඩාක් changes කරන්න අවශ්‍ය වෙන්න පුළුවන් ඒ patient. මමම දන්නවා ඔය psychiatric medicines එහෙම අවුරුදු 20 25 එක දිගට පාවිච්චි කරන patients ලා ඉන්නවා ડોක්ටර්ව හම්බ වෙන්නේ නැතුව. ඒකම ගොඩාක්ම භයානක දේ තමයි antibiotics වලට ඒගොල්ලන්ගේ පරණ prescriptions ගෙනල්ලා ඕගොල්ලන්ට අර දීලා prescriptions වලින් medicines ගන්න පුළුවන්. අපි දන්නවා ඒක ලොකු ප්‍රශ්නයක් නාට ඒක ලොකු ප්‍රශ්නයක් ඇත්තටම. මොකද antibiotic resistance කියන එකට අපි ඒකට මේ ප්‍රොමෝට් කරන්න බෑ. ඒකින්ද හැම වෙලාවෙම බලන්න outdated prescription එකක් ගේනවාද කියන එක. දෙවනියට බලන්න credentials of the prescriber. ඒ කියන්නේ SLMC number එක, ඒගොල්ලන්ගේ seal එක, sign එක තියෙනවද කියන එක. තුන අපිට බලන්න පුළුවන් හරිනම් අපි prescription එකක් dispense කරනකොට pharmacist sign කරනවා dispensed කියලා. එන්නේ ඒ විදිහට sign කරපු එකක්ද මේ ආයෙ නැවත නැවත ගේන්නේ කියන එක අපිට verify කරන්න පුළුවන්. එතකොට outdated prescriptions හරි ડોක්ටර් කෙනෙක් නොලියපු prescription එකක් හරි පාවිච්චි කරනවා නම් ඕගොල්ලන් ඒ ගැන ගොඩාක් vigilant වෙන්න ඕනේ. ඒක සුදුසු එකක්ද කියන එක බලන්න ඕනේ. ඒක තමයි checking the legality of the prescription කියලා කියන්නේ. දෙක තමයි completeness. Next slide. මේක හරිම important. මොකද අපි දෙවෙනි මේ step එක තමයි දෙවෙනි check එක. පළවෙනි check එක legality, දෙවෙනි check එක completeness. ඒ කියන්නේ pharmacist කෙනෙක්ට medicine නම විතරක් සහ strength එකයි කොහොමද ගන්න කියන එක විතරක් මදි. මොකද අපි තක්සේරු කරන්න ඕනේ, අපි check කරන්න ඕනේ, අපි evaluate කරන්න ඕනේ මේ medicines මේ patient හරිද කියන එක. මොකද අපි දන්නවා patient ගේ වයස, අපි දන්නවා patient අපි අහලා දැනගන්නවා patient තියෙන ප්‍රශ්නේ. අපි එතකොට බලන්න ඕනේ මේ ලියලා තියෙන medicines මේ patient හරිද කියන එක. මොකද ඒක අපේ වගකීම. අපි ඇත්තටම වැරදි දෙයක් කරොත් අපිට තමයි ඒ වගකීම එන්නේ. ඒකින්ද අපි ડોක්ටර් කෙනෙක් ලිව්වනේ ඒක ප්‍රශ්නයක් නෑනේ මම ඒක ෆලෝ කරනවා කියන පරමාර්ථයෙන් ඉන්න එපා. අපි කරන්න ඕනේ අපි ප්‍රොෆෙෂනල් කෙනෙක් විදිහට අපේ කාර්යභාරය තියෙනවා මේ තියෙන මෙඩිසින්ස් මේ ඉන්න patient සුදුසුයි කියන එක තක්සේරු කරන්න. ඒ තක්සේරුවට අපිට අවශ්‍ය ඉන්ෆර්මේෂන් ටිකක් තියෙනවා. ඒ ඉන්ෆර්මේෂන් නැත්තම් අපිට ඒ තක්සේරුව හරියට කරන්න බෑ. ඒව තමයි ඉස්සෙල්ලාම patient ගේ details ඕනේ. ඒගොල්ලන්ගේ නම හරි ඒක නැතත් age එක සමහර වෙලාවට weight එක. පුංචි ළමයෙක් නම් අපි dose එක හදන්නේ weight එකකින් නේ. එතකොට weight එක අත්‍යවශ්‍යයි. දෙක තමයි medicine related information ටික. එතකොට drug name එක තියෙන්න ඕනේ. strength එක තියෙන්න ඕනේ. frequency එක තියෙන්න ඕනේ. කියන්නේ දවසට කී වතාවක් ගන්නවද කියන එක තියෙන්න ඕනේ. කොච්චර කාලයකටද කියන එක තියෙන්නේ. එතකොට ඒ ටික නැත්තම් අපිට හරියටම තක්සේරු කරන්න බෑ මේ patient දෙන medicines ටික හරිද කියන එක. එතකොට උදාහරණයක් විදිහට සමහර වෙලාවට එනවා medicine name එක එනවා strength එක ඉන්නේ. එතකොට ඔයගලන්ට strengths දෙකක් තියෙනවා නම් ගොඩක් වෙලාවට ඔයගලන් පාවිච්චි කරන්නේ අඩු strength එක. අඩු strength එකෙන් දෙනවා. ඔයගලන් හිතනවා හරි අඩු strength එකෙන් දුන්නාම patient හානියක් නැහැනේ කියලා. හැබැයි අඩු strength එක දුන්නාම ඒගොල්ලන්ට ඒකෙන් අවශ්‍ය therapeutic effect එක ලැබෙන්නේ නැති වෙන්න පුළුවන්. ඒකින්ද ඒක සුදුසු දෙයක් නෙමෙයි. අපි මේ information සියල්ලම තියනවාද කියලා බලන්න ඕනේ. නැත්තම් අපිට ඒක ප්‍රශ්නයක් නම් missing information හින්දා ඒවා guess කරලා dispense කරන්න එක සුදුසු නැහැ. ඒක හින්දා අපි දෙවනි check එක විදිහට completeness කියන එක බලන්න ඕනේ. Next slide.
Madam, shall we give it to this? Really?
Yes. Okay. අපි third check එක මේ translation එකෙන් පස්සේ බලමු. අපි
Really, you can do it.
தேங்க்யூ மேடம். அடுத்ததாக ஒரு ப்ரெசிஷன், அதாவது ஒரு மருத்துவ சிட்டுகள் வருகின்ற போது அதை நாங்கள் எவ்வாறு பரிசோதிக்க வேண்டும். அதிலே 3 விடயங்கள் மிக முக்கியமாக நாங்கள் கவனம் செலுத்த வேண்டும். அதுல முதலாவது விடயம் லெஜிலரி, அதாவது இது உண்மையாகவே தகுதியான ஒரு மருந்து சிட்டா என்பதை நாங்கள் கவனிக்க வேண்டும். இரண்டாவது, இது வந்துட்டு முழுமையான ஒரு மருந்து சீட்டாக இருக்கின்றதா. அது அடுத்தது மூன்றாவது விடயம், இந்த சிட்டில் எழுதப்பட்டிருக்கின்ற சகல மருந்துகளும் அதுக்கு ஏற்றவாறு அதனுடைய ஸ்ட்ரென்த், அதாவது அதனுடைய மில்லிகிராம் அதுகள் எல்லாம் சரியான முறையில் குறிக்கப்பட்டிருக்கின்றதை செக் பண்ண வேண்டும், பரிசோதிக்க வேண்டும். அதிலே முதலாவது விஷயத்தை நாங்கள் விரிவாக பார்ப்போமாக இருந்தால், முதலாவது அந்த மருந்து சிட்டிலே எழுதப்பட்டிருக்கின்ற டேட், அதாவது திகதி, அதை நாங்கள் கட்டாயம் பார்க்க வேண்டும். காரணம், மேடம் வந்துட்டு சொன்னாங்க, அதாவது சில பேஷண்ட், சில நோயாளிகள் ஒரே மருந்து சிட்டை வந்துட்டு மீண்டும் வைத்தியரிடம் செல்லாமல், காட்டாமல், பரிசோதிக்காமல் தொடர்ந்து அதுக்கான மருந்தை தொடர்ந்து பாவிப்பது, இது அவருடைய சுகாதாரத்துக்கு உகந்தது இல்லை. ஆகவே இந்த மருந்து சிட்டில் குறிக்கப்பட்டுள்ள இந்த திகதியானதை எப்போது குறிக்கப்பட்டுள்ளது என்பதையும் இப்போது எடுக்கின்ற காலப்பகுதியையும் நாங்கள் பரிசோதிக்க வேண்டும் என்பதை மிகவும் கட்டாயமாக வலியுறுத்தப்பட்டது. அதே போன்றுதான் அந்த மருந்து சீட்டிலேயே எழுதப்பட்டுள்ள வைத்தியருடைய பெயர், அவருடைய SLMC ரெஜிஸ்ட்ரேஷன் நம்பர், அதாவது அவருடைய SLMC ரெஜிஸ்டர் பண்ணிக்கின்ற அதுல இலக்கம் இருக்கின்றதா. அதே மாதிரி அந்த வைத்தியருடைய சீல், அதாவது ரப்பர் ஸ்டாம்ப் வந்துட்டு பொறிக்கப்பட்டிருக்கின்றதா, அதுல அழைக்கப்பட்டிருக்கின்றதா. அதே மாதிரி அந்த வைத்தியருடைய கையெழுத்து விடப்பட்டுள்ளதா என்பதையும் நாங்கள் மிகவும் கவனமான முறையிலே அதை பரிசோதிக்க வேண்டும். காரணம், சில பிரைவேட், அதாவது தனியார் வைத்தியசாலைகளுடைய மருந்து சீட்டுகளை, போலியான மருந்து சீட்டுகளை கொண்டு வந்து இப்போது காணப்படுகின்ற சிலது அவருடைய உடலுக்கு தகுதியற்ற, உகந்ததற்றான மருந்துகளை வாங்கி அவர்கள் பல நோய்களுக்கு உள்ளாகின்ற போது அதுகள் பிற்காலத்தில் பரிசோதிக்கப்படுகின்றது. எங்களுக்கு அதனால பல பிரச்சனைகளை எதிர்நோக்க வேண்டி வரும் என்பதற்காகத்தான் மேலே குறிப்பிட்ட 3 விடயங்களும் இருக்கின்றதா என்பதை நாங்கள் கட்டாயம் பரிசோதிக்க வேண்டும். அதாவது அதற்குரிய மருந்துகளை விநியோகிக்கின்றதுக்கு முன்பாக. அதே போன்றுதான் இந்த மருந்து சிட்டுகளில் குறிப்பிட்டுள்ள அதாவது விடயங்கள் சரியாக உள்ளதா. அதுல முதலாவது விடயம் வந்துட்டு பேஷனுடைய பெயர், அதாவது அந்த நோயாளுடைய பெயர் குறிக்கப்பட்டுள்ளதா. அதே மாதிரி அந்த அதாவது அத்தியாவசியம், எசென்சியல்ங்கிறது அத்தியாவசியமான விஷயங்கள், அதோட சம்பந்தப்பட்ட விடயங்கள் குறிக்கப்பட்டுள்ளதா. அதிலே முதலாவது அந்த மருந்தினுடைய பெயர், குறிக்கப்பட்டிருக்கிறத பாடம். அதே போது அதனுடைய ஸ்ட்ரென்த், அதாவது அது மில்லிகிராம், ml, அதாவது ஈச் 5 ml. அப்ப நாங்கள் அது சரியான முறையிலே குறிக்கப்பட்டுள்ளதா என்பதை நாங்கள் அதையும் கட்டாயம் கருத்தில் கொள்ள வேண்டும். அதே மாதிரி அதோட டோசேஜ், அதாவது அந்த மருந்து அந்த பேஷனுக்கு கொடுக்கப்படுகின்ற அளவு சரியாக குறிக்கப்பட்டிருக்கின்றதா. அத வைத்தியர் எழுதப்பட்டிருக்கிறத நாங்கள் கொடுக்கணும் நாங்கள் யோசிக்க தெரியும். ஏன்னா நாங்கள் பயிற்றுவிக்கப்பட்ட ஒரு பார்மசிஸ்ட் என்பதால் எங்களுக்கு சகல விடயங்கள் நாங்கள் அறிந்திருப்பதால் இது கட்டாயம் முக்கியமான விடயம் என்பதையும் மேடம் அவர்கள் இந்த இடத்திலே சுட்டிக்காட்டினார்கள். அதே மாதிரி இந்த மருந்து தொடர்ந்து பாவிக்கக்கூடியதா, அல்லது இது தொடர்ந்து பாவிப்பதால் அந்த நோயாளிக்கு மேலதிகமான ஏதும் பிரச்சனைகள் ஏற்படுமா இருந்தால் எதிர்காலத்தில் அவர் இன்னும் பல நோய்களை உள்வாங்கக்கூடும். ஆகவே அவருக்கான அந்த அறிவுறுத்தல்களையும் நாங்கள் வழங்க வேண்டும் என்பதையும் அதிலே சொல்லப்பட்டிருக்கிறது. அதே போன்றுதான் நான் ஏற்கனவே கூறினது போன்று இந்த மருந்து காலங்களுக்கு பாவிக்கணும், இதை விட பாவிக்க தேவையில்லையா அல்லது பாவிக்க முடியுமா என்பதையும் நாங்கள் கட்டாயம் அந்த நோயாளிக்கு அறிவுறுத்தல் வழங்க வேண்டும். அதே மாதிரி மேலே குறிப்பிட்டப்பட்டுள்ள இந்த விடயங்கள் அதாவது தவறு இல்லாமல் நாங்கள் தொடர்ந்து பாவிக்கின்ற போது நாங்கள் என்ன செய்யலாம், ஒரு நோயாளியினுடைய அதாவது சாட்டிஸ்பாக்சன், அவருடைய திருப்தியை நாங்கள் பெற்றுக்கொள்ள முடியும். அதே நேரம் அவரும் ஒரு நீண்ட ஆயுளோடு வாழ்வதற்குரிய ஒரு சந்தர்ப்பமா அமையும் என்பதையும் இந்த விடயம் வந்து எங்களுக்கு மிக முக்கியமாக சொல்லப்படுகின்றது. Madam, thanks, madam.
Right. So let's go to the next slide. Now you do the legality check. Then the completeness. Yeah. Shall I go on? Right. So third is the appropriateness. Right? ඒ කියන්නේ අපි ඉස්සෙල්ලාම ලීගැලිටි බැලුවා ඊට පස්සේ ඔක්කොම කරුණු අපිට අවශ්‍ය දේවල් තියෙනවද බැලුවා මොකද අවශ්‍ය දේවල් නැත්නම් අපිට තීරණයක් ගන්න අමාරුයි එතකොට සමහර වෙලාවට අත්‍යවශ්‍ය කරුණු නැති වුණත් තීරණ ගන්න පුළුවන් වෙන්න පුළුවන් ඒක ඕගොල්ලන් තක්සේරු කරන්න හැබැයි ඉස්සෙල්ලාම බලන්න මේ ඉන්ෆර්මේෂන් තියෙනවද කියලා ඔයාට ගෙස් කරන්න අවශ්‍යතාවයක් තියෙනවා නම් ඒක එච්චර සේෆ් ස්ටෙප් එකක් නෙමෙයි right තුන තමයි අපි බලන්න ඕනේ ඒ තියෙන කරුණු මත මේ මෙඩිසින්ස් appropriate ද කියලා. ඒ කියන්නේ මේවා සුදුසුද කියලා. සමහර වෙලාවට අපි ඔක්කොම මනුෂ්‍යයන්නේ. We are all humans. So we can all make mistakes. Sometimes the doctor might have made a mistake in the dosing or the strength that they have written or the frequency that they have written. So that is a human issue. You also can go wrong. I also can go wrong. The doctor also can go wrong. So we have to view it as a team effect, team spirit. අපි හැම වෙලාවෙම ටීම් එකක් විදිහට වැඩ කරනවා කියන මානසිකත්වයෙන් තමයි වැඩ කරන්න ඕනේ. මේගොල්ලන් කරන්නේ වැරද්දක්, මේ ප්‍රෙස්ක්‍රිප්ෂන් එක වැරදීනේ. එහෙම කියන මානසිකත්වයෙන් කරනවට වඩා අපි බලන්න ඕනේ අපි එකතු වෙලා patient කොහොමද හරි බෙහෙත දෙන්නේ කියන එක. එතකොට ඒකට තමයි අපි ඇත්තටම මේක රිවිව් කරන්නේ. මේක බලන්නේ නැත්නම් අපි ඒක බලන්න ඕනේ නෑනේ. දොස්තරනේ වැරදි කියලා තියෙන්නේ. ඉතින් මොකද දුන්නාම මට ප්‍රශ්නයක් නෑනේ. එහෙම ඉන්න බෑ අපිට. අපි ටීම් එකක් විදිහට එකතු වෙලා අපි patient හොඳ දෙයක් කරන්න තමයි අපි උත්සාහ කරන්නේ. ඒකින්ද තමයි අපි ආයෙ චෙක් කරලා බලන්නේ මේ prescription එක හරි නේද කියලා. ඒකෝට සමහර වෙලාවට වැරදිලා contraindicated drugs ලියලා තියෙන්න පුළුවන්. සමහර වෙලාවට patient allergic හැබැයි allergic drugs ලියලා තියෙන්න පුළුවන්. සමහර වෙලාවට පුංචි ළමෙක් නම් pediatric patient කෙනෙක් නම් එයාට සුදුසු නැති drugs doses ලියලා තියෙන්න පුළුවන්. සමහර වෙලාවට වැරදි strengths ලියලා තියෙන්න පුළුවන්. වැරදි units තියෙන්න පුළුවන්. දැන් thyroxine 50 mg වගේ තියෙන්න පුළුවන්. ඒක නම් ඔයගොල්ලන් දන්නවා. හැබැයි මේ හැම එකක්ම ගොඩක්ම අපිට වැරදෙන්නේ මේ වගේ eligible prescriptions තියෙනකොට. ඔයගොල්ලන් හැමෝටම experience ඇති prescriptions එන්නේ නැහැ පැහැදිලිව ලියලා. ඒක ඇත්තටම සුදුසු දෙයක් නෙමෙයි. අපිට ඕන නම් අපිට කියවන්න බැරි නම් අපිට ඒක රිටර්න් කරන්නත් පුළුවන්. ඇත්තටම Tamanට කියවන්න බැරි නම් ඒක ගෙස් කරලා කියවන එක ඇත්තටම ගන්න unsafe step එකක්. ඉතින් ඉස්සෙල්ලාම අපි බලන්න ඕනේ අපිට කියවන්න පුළුවන්ද කියලා. හැබැයි කියවන්න බැරි මේ වගේ eligible prescriptions වලින් අපිට වැරදෙන්න පුළුවන් chance එක වැඩි. අපි wrong drug name එකක් කියවන්න පුළුවන්. ඔයගොල්ලන් දන්නවා ගොඩක් වෙලාවට metformin methotrexate mix up වෙලා patients ලා මැරිලා තියෙනවා. හැබැයි ඉතින් අපි කලින් අහලා තිබ්බනම් patient ගේ disease එක diabetes හරි rheumatoid arthritis හරි කියලා තිබ්බනම් අපිට පොඩි අනුමානයක් අපිට ටිකක් හිතන්න පුළුවන් මේ තියෙන්නේ මොකද්ද කියන එක. හැබැයි guess කරන එක සුදුසු නැහැ. හැම වෙලාවෙම තමන්ගේ තියෙන drugs prescription එකේ තියෙන drugs මේ patient හොඳයි නේද? okay නේද කියන එක verify කරන එක ඕගොල්ලන්ගේ යුතුයකමක්. සමහර වෙලාවට duplications තියෙන්න පුළුවන්. ඒ කියන්නේ එකම group එකේ drugs දෙකක් තියෙන්න පුළුවන්. For example, cetirizine and fexofenadine. Sometimes losartan and enalapril, which are not appropriate. Those are duplications. So ඒ වගේ දෙයක් ඔයාට මේක prescription එක බලලා හොයන්න පුළුවන්. සමහර වෙලාවට clinically important drug interactions තියෙන්න පුළුවන්. patient සුදුසු නැති වෙන. අන්න ඒ වගේ contraindicated drugs තියෙන්න පුළුවන්. අන්න ඒ වගේ අවස්ථාවකදී patient unsafe කියලා හිතනවා නම් ඒක ડોක්ටර් වෙතට යොමු කරන එක ඕගොල්ලන්ගේ යුතුයකම. හැබැයි අපි කවදාවත් prescription එකක් වෙනස් කරන්නේ නැහැ. pharmacist කෙනෙක්ගේ professionalism එක අපි රකින්නවා නම් අපි කවදාවත් prescription එකක් වෙනස් කරන්නේ නැහැ. අපි කරන්නේ එක්ක ડોක්ටර්ව contact කරලා ඒක වෙනස් කරලා දෙනවා. එහෙම නැත්නම් patient ડોක්ටර් ගාවට යවන එක. දැන් අපිට ඒකෙන් උත් පාඩුවක් වෙන්නත් පුළුවන්. patient එකෙන් කරදරයක් වෙන්නත් පුළුවන්. හැබැයි patient safety is first හින්දා ලොකු ප්‍රශ්න තියෙනවා නම් ඒව කවදාවත් තනියම විසඳන්න නැතුව ડોක්ටර් වෙතට යොමු කරන එක තමයි සුදුසුම දේ. හරි දැන් අපි 3 checks බැලුවා. ඒ කියන්නේ 1 legality, 2 completeness, 3 appropriateness. ඒ කියන්නේ මොනවත් drug related problem එකක් තියෙනවද කියන එක අපි assess කරන එක අපේ යුතුයකම. Next slide. දැන් එතකොට අපේ මේ dispensing cycle එකේ අපි දැන් දෙකක් ඉවර කරා. ඊළඟට තියෙන්නේ දැන් ඔන්න දැන් අපි check කරලා හරි මේ drugs මේ patient appropriate. දැන් තියෙන්නේ මේ drugs ටික prepare කරන්න. ඒක තමයි අපේ ඊළඟ step එක. Next slide. මේ drugs prepare කරනකොට අපි ගොඩාක් careful වෙන්න. හරි? එතකොට අපි prepare කරනකොටත් බොහෝ විට දැන් අපේ පළවෙනි step එක receiving the prescription, a pharmacist should be there. දෙවෙනි step එක preliminary prescription review නැත්නම් අර 3 checks. ඒකටත් pharmacist කෙනෙක් ඉන්නම ඕනේ. තුන්වෙනි එක preparing the medicines. අපිට ඒ කාර්යය දෙන්න පුළුවන්. ඒ වැඩේ අපිට දෙන්න පුළුවන් training කෙනෙක්ට කරන්න කියලා. හැබැයි pharmacist කෙනෙක් හැම වෙලාවෙම double check කරන්න ඕනේ අපි ඒකට එමු. ඒතකොට මේක pharmacist කෙනෙක් හෝ pharmacy assistant කෙනෙක්ට හෝ pharmacy trainee කෙනෙක්ට කරන්න පුළුවන් වැඩක්. හැබැයි අන්තිමට pharmacist මේක check කරන්න ඕනේ. හැබැයි අපි medicines prepare කරනකොට අපිට rules ටිකක් තියෙනවා. ඒ කියන්නේ හොඳ පුරුදු ටිකක් තියෙනවා. ඒ කියන්නේ good dispensing practices ටිකක් තියෙනවා. අපි හැම වෙලාවෙම ඒක නිකන් රොබෝ කෙනෙක් වගේ ඒක පිළිපදින්න ඕනේ. දැන් මෙතනත් අපිට තියෙනවා 3 checks. අපි ගොඩක් වෙලාවට දැන් medicines prepare කරන්න පටන් ගන්නකොට අපි ගොඩක් වෙලාවට shelf එකෙන් මේ medicine එක අරගෙන ඒ වැඩේ කරනවානේ. එතකොට medicine එකක් ගන්නකොට අපි අතින් වැරදි medicine එක ගන්න ඉඩ තියෙනවා. නැත්තම් ගොඩක් වෙලාවට ඔයගලන් කරන්නේ ඔක්කොම medicines අවශ්‍ය ටික එක ළඟ තියාගෙන ඒවා prepare කරනවා. එතකොට ගොඩක් වෙලාවට වෙන්නේ වැරදි envelope එකට, වැරදි package එකට වැරදි medicine එක දාන්න පුළුවන් chance එක වැඩි. ඒකින්ද අපි එක තමයි ඉස්සෙල්ලාම එකක් prepare කරලා ඉවර වෙලා තමයි දෙවෙනි එක prepare කරන්නේ. ඊට පස්සේ ඒක ඉවර වෙලා තමයි තුන්වෙනි එක prepare කරන්නේ. ඒ විදිහට one by one යන්නේ නැත්තම් අපිට mix up කරන්න තියෙන chance එක වැඩි. ඒ අපි පිළිපදින්න ඕනේ එක හොඳ rule එකක්. මොකද අපිත් humans ලා හින්දා අපිටත් වරදින්න පුළුවන්. කලබලයක් තියෙන්න පුළුවන්. අපිට වැඩ වැඩි වෙලා තියෙන්න පුළුවන්. ඒ දවස් අපිට හොඳ නැති දවසක් වෙන්න පුළුවන්. ඒ මානසිකත්වයත් එක්ක අපිට වරදින්න පුළුවන්. ඒකින්ද මේ හොඳ පුරුදු පිළිපැද්දොත් රොබෝ කෙනෙක් වගේ අපිට වරදින chances අඩුයි. එතකොට හැම වෙලාවෙම අපි මෙඩිසින් එකක් ෂෙල්ෆ් එකකින් අරගන්නකොට ප්‍රිපෙයාර් කරන්න 3 checks තියෙනවා එතනත්. ඒ කියන්නේ අපි ෂෙල්ෆ් එකකින් ගන්නකොට නමයි ස්ට්‍රෙන්ත් එකයි කියවලා බලන්න. ප්‍රිපෙයාර් කරනකොට ඒ කියන්නේ මේ මෙඩිසින්ස් ටික කන්ටේනර් එකකින් අරගෙන එන්වෙලොප් එකට දානකොට හරි නේද කියලා නමයි ස්ට්‍රෙන්ත් එකයි බලනවා. ඒක වැඩේ ඉවරන ගමන්ම අපි වහලා ආපහු ෂෙල්ෆ් එකෙන් තියන්න ඕනේ අනිත් ඩ්‍රග් එක ප්‍රිපෙයාර් කරන්න ඉස්සෙල්ලා. එතකොටත් අපි හරි නේද කියලා බලලා තමයි කියන්නේ. මේවා නර්ස්ලටත් තියෙනවා ඒගොල්ලන්ගේ ඇඩ්මිනිස්ට්‍රේෂන් වලදී. හැබැයි මේක ඩිස්පෙන්සිං වලදී අපි 3 checks කියලා ගන්නෙ. Check the container when you take it off the shelf. Check when you remove the medicines from the container and put it in the envelope. Check when you're replacing the container back. Just to triple check that you have dispensed the right medications. මේක වඩාත්ම important වෙන්නේ මේ ලාසා කියන important aspect එක හින්දා. Maybe you should do a translation and before I do a lasa. Ralina, are you going to do the translation? Because I want to explain lasa after that.
Radhi, can you unmute Raleigh?
Okay, wait. Actually, I can't. He can unmute himself.
Right. Okay, I'll go on. Maybe then, Riza, you can stop me when you think I should stop. Next slide.
You can go up to 20 and
Yeah,
we'll stop
okay.
there.
Right. Okay.
Then he'll do it.
Right. Next slide, please. So, අපි මේ 3 checks කියන එක කරන්නේ ඔයගොල්ලන් හිතයි ඇයි මෙච්චර check කරන්නේ අපිට මෙච්චර වරදින්න පුළුවන්ද එහෙම කියලා. ඔව් අපිට වරදින්න පුළුවන්. ඒක research වලිනුත් හොයාගෙන තියෙනවා. Practical scenarios වලින් patients ලට harm වෙලා තියෙනවා. අපිට වරදින්න පුළුවන්. ඒකින්ද අපි ඒක කරනවා. හැබැයි විශේෂම හේතුව තමයි මේ ලාසා මෙඩිසින් කියන concept එක. ලාසා මෙඩිසින් කියන concept එකෙන් කියන්නේ ලාසා කියලා කියන්නේ look alike, sound alike medicine name, medicines කියන එක. ලාසා drugs කියලා අපි කියන්නේ. හැම වෙලාවම ඔයගොල්ලෝ මතක තියාගන්න ඕනේ අපිට ලාසා ඩ්‍රග්ස් තියෙන්න පුළුවන්. ඒ ලාසා ඩ්‍රග්ස් කියලා කියන්නේ එක වගේ පේන ඩ්‍රග්ස්. හරි? ඒ එක වගේ පේන ඩ්‍රග්ස් අපි ෂෙල්ෆ් එකකින් අරන් ගන්නකොට හරි ප්‍රිස්ක්‍රිප්ෂන් එකක කියවනකොට හරි ඒක වැරදිලා ඒක සමාන අනිත් එක ගන්න ඉඩ තියෙනවා. ඒක තමයි අපිට විශේෂම මේ වගේ චෙක්ස් කරන්න හේතුව. එතකොට look alike sound alike names තියෙනවා. මේවා විශේෂයෙන්ම වැදගත් වෙන්නේ prescription එකක් කියවනකොට. prescription එකක් කියවනකොට අපි clobazam වෙනුවට clonazepam කියලා කියවන්න පුළුවන්. මොකද they look alike. Right? Dilantin sodium වෙනුවට diclofenac sodium කියලා අපි කියවන්න පුළුවන්. Because they look alike in a very illegible prescription, they look exactly the same. And Losec වෙනුවට Lasix කියලා කියවන්න පුළුවන්. ඒ මොකද ඒවා look alike හින්දා. දැන් මෙතන දාලා තියෙන examples තුන සමහර වෙලාවට generic names generic medicine names සමාන වෙන්න පුළුවන්. ලාසා වෙන්න පුළුවන්. සමහර වෙලාවට generic name එකක් සමාන වෙන්න පුළුවන් තව එකක brand name එකක් එක්ක. Like Dilantin sodium and diclofenac sodium. Or brand names දෙකක් සමාන වෙන්න පුළුවන්. Like Losec and Lasix. ඒකින්ද අපි ගොඩාක් careful වෙන්න ඕනේ. shelf එකේ තියෙන නම් උත් ඔය වගේ mistake වෙන්න පුළුවන්. Prescription එකේ තියෙන medicines උත් ඔය වගේ වෙන්න පුළුවන්. Methotrexate, metformin, carbamazepine, carbimazole ඒවා හරීම common examples අපිට වරදින. ඒකින්ද look alike sound alike names තියෙන්න පුළුවන්. Next slide. Look alike sound like look alike medicine packages තියෙන්න පුළුවන්. එකම වගේ packages තියෙන ඒවා අපේ shelf එකේ එක ළඟ තියලා තියෙන්න පුළුවන්. Right? දැන් මේ තියෙන මේ වගේ examples තමයි. Ephedrine and adrenaline. බලන්න කොච්චර සමානයිද කියලා. Ondansetron and phenylephrine. Metoclopramide and ondansetron. දැන් මේ වගේ දෙයක් drug trolley එකේ තියෙනකොට හරි shelf එකේ තියෙනකොට හරි අපිට pick කරන්න පුළුවන් වැරදි එක pick කරන්න පුළුවන් chance එක ගොඩාක් වැඩි. ගොඩාක් වෙලාවට drug trolley එක තියෙනකොට අපිට අර lid එක විතරයි පේන්නේ. බලන්න පල්හා picture එකේ තියෙන lid එක විතරයි. එතකොට lids දෙක identical. අපි වෙන එකක් pick කරන්න පුළුවන්. ඒක තමයි අපි අර 3 checks කරන්නේ. 3 checks කරාම අපිට verify කරන්න පුළුවන් මේ අපි අරන් තියෙන්නේ හරිද කියලා. Next slide එකෙන් තවත් දෙයක් පේනවා ඔයගලන්ට. Next slide. බලන්න සමහර වෙලාවට ඔයගලන්ගේ clinic count එකේ ඔයගොල්ලෝ මේ වගේ pre-packed medicines තියාගෙන ඉන්නවානේ patients ලට දෙන්න especially in state hospitals. එතකොට මේ බලන්න medicine dosage form එක appearance එක හරියම identical වෙන අවස්ථාවක් තියෙනවා. දැන් paracetamol and metformin උනත් ගොඩක් වෙලාවට සමානයිනේ. එතකොට අපි වැරදි pack එක pick කරලා දෙන්න පුළුවන් chance එක ගොඩාක් වැඩි. මේ right hand corner එකේ බලන්න warfarin strength 3 නේ warfarin medicines වල strength 3 ඒවා mistake වෙන්න ගොඩාක් chances තියෙනවා. ඒකෙන් හින්දා තමයි අපි medicines prepare කරනකොට අපේ good dispensing practices හැටියට අර 3 checks කරන්නේ. Right? Next slide. එතකොට මේ good dispensing practices විදිහට ඒ 3 checks කරන එක වගේම මතක තියාගන්න හැම වෙලාවම prepare one type of medicine at a time. So prepare one medicine, keep the container back and then go to the next one. That's another good practice. Replace back the දැන් මොකක් හරි වා එකක් ඉවර කරා නම් ඒකත් එතන තියෙද්දි තව එකක් ගන්න පුළුවන්. එපා. මොකද එතකොට අපිට lids හරි මාරු වෙන්න ඉඩ තියෙනවා. සමහර වෙලාවට lids වල තමයි නම දාලා තියෙන්නේ. එතකොට නම තියෙන lids මාරු වෙන්න පුළුවන්. එතකොට replace back in proper place before starting the preparation of that. So you take the bottle or the container, prepare it, close it, keep it back, and then start preparing the next one. And that's the best practice because otherwise you might make mistakes. Also, check for expiry dates and near expiry dates because sometimes අපි දැන් හිතමු near expiry drug එකක් අපි patient කෙනෙක්ට මාසයකට දෙනවා නම් එතකොට ඒගොල්ලන් patient ගන්න අතර ඒක expire වෙනවා නම් අපි ඒක කරන් අපි ඒක responsible වැඩක් නෙමෙයි නේ. අපි ඒ වගේ දේවලුත් හැම වෙලාවම ඔළුවේ මතක තියාගෙන ඉඳලා check කරන්න ඕනේ. Right. Next slide. Next thing, දැන් medicine packaging වලදී අපි හරියට දැන් medicines ටික අරගෙන medicines ටික pack කරනවා. ඒ pack කරන medicines වල information අපි හරියට ලියන්න. හරි? දැන් අපි prescriptions වලට ගොඩාක් වෙලාවට කෑ ගහනවා හරි eligible prescriptions එන්නේ අපහැදිලි prescriptions එන්නේ කියලා. ඒ වුණාට ඕගොල්ලන්ගේ dispensing labels බලනකොට, ඒ කියන්නේ envelopes බලනකොට සමහර වෙලාවට ඒක information ඇත්තෙම නැහැ. එක්කෝ information අපහැදිලි, unclear or incomplete. So it's very, very important that you have a very clear instructions written on the envelope. Here you don't go to write everything, right? You have some extremely okay. So I have some people say I have to go in English, so I'll go in English. So you in labels, there are some, you don't write everything there, but there are essential information that you must write on a label or an envelope. What is that? The patient name and age, if you want. That's important, of course. But here, the important things are the medicine name. Sometimes you never write the medicine name, or sometimes it's abbreviation. නිකන් abbreviation එකක් ඕගලන් ලියනවා CBX හරි PACM හරි PCM හැමෝම දන්නවා. ඒ උනාට patient දන්නේ නැහනේ. Right? Patient කෙනෙක්ට හැම වෙලාවෙම එන්න ඕනේ right to know what the medicines they're taking. Or show somebody else and say, can you please tell me what am I taking? So if you have not written the information on the envelope or the dispensing label, not even a professional can ever tell that patient what they're taking. So you have to give them that right, and you have to write the medicine name, you have to write the medicine strength, you have to write the number of units you have to take at a time. That means 2 tablets at a time or 1 tablet at a time. Likewise, and the number of times to be taken, frequency. So medicine name, strength, how many units you should take at a time. අපි කියනවානේ tablets දෙකක් හරි tablets එකක් හරි දවසට දෙපාරක් හරි තුන් පාරක් හරි, the frequency you must write. At least for antibiotics and for short-term medicines like prednisolone, short-term, all those drugs, you have to write the duration. For how long? 7 days or 5 days or 3 days, or how to tail it off. But maybe not for the long-term medicines. That goes for months and months. But at least for the short-term medicines, you have to write the duration. And if there is a special instruction, like take it before meals or take it after meals, you can write that. But if there's nothing like that, don't write and confuse the patient, just for the sake of writing. For example, don't write before or after meals if it doesn't matter. But if it matters, you must write. Also, it has to be complete. For example, thyroxine, you say take it before meals. That's not right, no. You have to say 1 hour before meals or in an empty stomach. Or for pantoprazole and omeprazole, you have to say at least half an hour before meals or 1 hour after meals. If you say after meals, they can eat and take just after also, right? So just after meals or 1 hour after meals, those things you must clarify on your prescription. And also the total number of units you are putting into the envelope. ඒ කියන්නේ ඔයා දාලා තියෙනවා නම් 10 tablets or pack කරනවා නම් 10 tablets කියලා ඔයාගේ ලියන්න ඕනේ. මම දවසක් prescription එකක් මම ගන්නකොට medicines ඒ pharmacist වැරදි number එක ලිව්වා. ඒකෙන් මම දැනගත්තා වැරදියට dispense කරා කියලා. මේ වගේ දේවල් අපිට අහු වෙනවා. ඒකින්ද මේ essential information ටික අපි අනිවාර්යයෙන්ම මේකේ ලියන්න ඕනේ. එතකොට අපි ගොඩාක් information ලියන්නේ essential ටික අත්‍යවශ්‍යයි. Medicine name, strength, dose, that is the number of units you take at a time and the frequency, the duration, and any other special instruction, not a lot, before meals, after meals, and those kind of things you have to write. And it has to be clear. Sometimes I have seen there are medicine labels with those, the typed ones, not the typed ones, but where you put a seal on it. The seal is very light and you can't see anything. It's just a very light seal. So that is also not appropriate. Language is important. Like now, some of you all of you all. I mean, professionals should know their English, but others, patients, you can't expect them, right? So the language that you write is important, because I know a patient who suffered and got readmitted to hospital because she didn't understand the instruction that was given to her. her. She was a rheumatoid arthritis patient who was given leflunomide, and they found out that she's allergic to it. The doctor told her it's allergic, don't take it, but she didn't understand it. She was a Tamil patient. She didn't understand it, and then she took it. She was hospitalized again with a huge ulcer on the leg because of the allergic reaction to leflunomide. Now that's very unfortunate, and that is why we have to make sure people that we are responsible enough to give the right instruction to our patient in the right way, clearly and in the proper language. Okay. And also when you're packaging things like suppositories, insulin, there are some responsible things that you must do. Suppositories you must pack with the ice pack. Insulin also you have to pack it and give it in an appropriate way so that it doesn't get deteriorated when they're traveling, especially in the hot sun, right? So those things you must take extra action so that you are a professional who's ensuring that medications don't harm patients. Next slide. Right, I think this is time for a translation result because I'm going to the next.
Madam, you can, madam, you run through, I think 3 slides to go, and
Okay.
after that I'll give you, madam. No problem.
Okay, right. So now we have received the prescription. We have done a preliminary prescription review, and then we have now prepared the medicines appropriately. Of course, the next step is recording and billing it. That is not a big issue, but that's an important step because that will give you a record of the medicines and the patient that you are dealing with. Next is double checking. Now I told you, now if you look at this dispensing cycle, some of the circles I have put a red outline, and some of these I haven't put a red outline. So for receiving the prescription and a preliminary prescription review, I have put a red outline. That means a pharmacist must do it, or pharmacist must supervise somebody else doing it. But preparing the medicines and recording billing, it does not have to be a pharmacist per se, but if it's not a pharmacist who's preparing the medicines, it has to be double checked. That's the other circle, which is with a red circle around it or red outline around it. They have to double check and make sure that they are correctly packed. So you double check with the prescription against the medicine instructions written on the label, as well as the medicines inside, to double check and see if all the medicines have been prepared appropriately. Next slide. So double checking, you have to double check the dispensed medicines and the instruction labels to see. In Hong Kong, when I was training, the junior pharmacist prepared it, but the senior pharmacist takes each label, reads it against the prescription, and he puts a signature after double checking. And that's how they ensure that there is no mistakes happening. Also, you can reconcile, you can match to see, okay, these medicines match with the patient's medical profile. That means diabetes or rheumatoid arthritis, no? So if it's a rheumatoid arthritis patient getting metformin, no, and diabetes patient getting rheumatoid arthritis medicine, that is a discrepancy. Then you know something's wrong. So therefore, double checking that is important. And also, once you have finished dispensing, you have to sign on the prescription to say that you have dispensed. Sometimes in your pharmacy, you may have some of the medicines and not some of them. And then you have to mark the ones that you have dispensed and sign it. And others you can write not dispensed. Also, sometimes you might have patients who come and buy not the whole months supply of medicines, but for a week. Then you can write 1 week supply dispense. But that's a responsible thing for you to do, because then when the prescription is taken to another pharmacist, they know what you have done, right? Next slide. So now double checking, and next is the most other, like the receiving of the prescription, handing over the medicines to the patient is an extremely important aspect. Next slide. So when you have to hand over, that is another important thing. So you have to verify who is in front of you. There are instances, and if you are a hospital pharmacist, you may know that there are so many people crowding in front of your window, and they might pick up the wrong patient might pick up the wrong medicines. So you have to ensure who's in front of you. Is it the right patient? You usually use 2 identifiers. That is the rule. You don't ask, are you someone only? Because there can be, unfortunately, another someone also there. So are you someone 35 years, or are you someone, and like in bank details, you get, they verify 2 information from you. Likewise, it's best you can ask 2 things, because unfortunately, with 1 name, you can have 2 patients. I have had that experience also. So verify patients before handing over the medicines. First, assess the patient's level of understanding. If the patient is very old and can't hear and is not cognitively ready to receive your instructions, there's no point in giving you big information to them, right? So then you must give the simple instructions. This is how to take it, right? But if it's a person who can understand, you think, because it is your assessment, right? That's why we don't put robots there. We have a pharmacist there to assess if that patient is able to understand. And then you give some more information. You have to tell them at the medicine instruction, administration instructions, how to take the medicines at least. You can tell them some possible side effects that can happen, but side effects also, what to do. Some side effects, you don't have to worry, it will pass, right? So in those cases, if those side effects come, you don't worry. That's what you tell the patient. If some side effects are there, which you have to worry and come and see the doctor. That you have to tell them. If something like this happens, you stop the medicine and come. Otherwise, they will stop it and just wait at home, right? So tell the medicine administration instructions, tell that possible side effects and what to do if the side effects occur. Not everything in the list, but the common ones. And how to contact. So pharmacist should be the one to be contacted. You should be the one that people come to for medicine related issues. So you can always say, here's my number, come and ask me, come and talk to me if there's a problem. Don't stop taking medicines, right? And verify whether the patient understood it. The way to verify is not to ask, did you understand? Because every patient will say yes. And then you don't have any assurance whether the patient understood or not. Then what you have to do is, you tell the patient, can you tell me how to take this medicine, please? I know this takes time. And if you're in a hospital pharmacist, I know your chief pharmacist and the director of the hospital are very keen on clearing the lines and forcing you. But that does not mean you compromise on these. Let them. But here is your responsibility to ensure that patients take these medicines in a responsible way, right? So very importantly, you have to give these instructions based on the patient's level of understanding, the patient in front of you. Next slide.
Madam, next slide is our quiz actually.
Right, okay.
You have given the answer in that. So
Yeah.
we are keeping that.
Right, okay. So therefore,
Madam,
I will also keep quiet about that then and summarize and tell. So that is the core requirements that a pharmacist must go through when you're dispensing a medicine. So now you can see there is a bit more than what lots of people usually do. Lots of people receive the prescription, quickly read what the medicines are, check whether they are available, maybe ask for the brands they want, and quickly prepare them, write them, and give. But that way, we are not responsible pharmacists. We don't have to have had such a lot of training and teaching and experience for to do that. Anybody who sits in a pharmacy for a long time can do that. But your responsibility is to ensure that there is no harm and people use their medications in a responsible way. For that, you have to at least follow these steps. Risa, it's up to you now.
Madam, keep holding. Don't log off.
Yeah, I want it.
Raleen, can you sum up the last slide? That will be great, since at the best interest of time. Sorry, Nalin.
Okay,
Last
Riza.
time. Yeah.
ஓகே ரிசா. ஆகவே நாங்கள் இந்த அதாவது 2 தரம் எவ்வாறு செக் பண்ணக்கூடியது, 3 தரம் எவ்வாறு செக் பண்ண விஷயங்களிலே கூடுதலாக மேடமாக ஞாபகப்படுத்தியிருக்கின்றார்கள். அதிலே முக்கியமான விடயம் வந்து நாங்கள் செல்ஃப்ல இருந்து அந்த ட்ரக்ஸ்களை எடுக்கின்ற போது, மருந்து எடுக்கின்ற போது அதே பெக்லே விட்டு அந்த முதலாவது அந்த கொடுத்து போட்டுதான் 2வது மருந்தை நாங்கள் ப்ரிப்பேர் பண்ணணும், அடுத்தது எடுக்க வேண்டும் என்பதையும் மென்ஷன் பண்ணியிருக்கிறார்கள். அதே போதுதான் அந்த லுக் லைக் சவுண்ட்ங்கிறது வந்துட்டு மிகவும் கவனமாக கையாள வேண்டிய ஒரு விஷயம் என்றால், பொதுவான அந்த ஜெனரிக் நேம்ங்கிறதையும் அதே மருந்து நாங்கள் மொழிபெயர்க்கின்ற போது வித்தியாசமாகவும் நாங்கள் எடுக்கின்ற போது வித்தியாசமாக அமையும். அதனாலே தவறான மருந்துகளை நாங்கள் கொடுக்கக்கூடிய சந்தர்ப்பங்கள் அமையும். ஆகவே அதுகளையும் மிக கவனமான முறையிலேயே நாங்கள் கையாள வேண்டும் என்பதையும் சொல்லியிருக்கின்றார்கள். அதே போது இன்ஜெக்ஷன்ஸ் வந்து அந்த கண்டெய்னர் அந்த ஒரே லேபிள்ல இருக்கும். அதனால நாங்கள் கட்டாயம் சரியான முறையிலே வாசித்து அதற்கான மருந்துகளையும் நாங்கள் கொடுக்க வேண்டும் என்பதை சொல்லியிருக்கிறார்கள். அதே போது அந்த பேக்கிங், அதாவது டெப்லெட்டுகளை நாங்கள் கவர்களை விடுகின்ற போது அதில் கட்டாயம் அந்த மருந்துகளுடைய பெயர், அது ஸ்ட்ரென்த் வந்து என்ன இதுல இருக்கின்றது, அதே மாதிரி அது எவ்வாறு பாவிக்கப்படும், எவ்வளவு காலத்துக்கு பாவிக்கப்பட வேண்டும் என்பதையும் நாங்கள் கட்டாயம் அதிலே குறிப்பிட வேண்டும் என்பதையும் சொல்லியிருக்கின்றார்கள். அதே போது நாங்கள் கடைசியாக மருந்தை விநியோகிக்கின்ற போது நாங்கள் 2 தரம், அதாவது டபுள் செக்கிங் என்று சொல்லியிருக்கிறார்கள். அதாவது எங்கள் மூலமாக ஒரு மெயின் பார்மசிஸ்ட் மூலமாக ட்ரைனிங், அதாவது பயிற்சியளிக்கப்பட்ட ஒரு நபரால அந்த இதுகள் அதாவது தயாரிக்கப்பட்டிருந்தால் அதை கட்டாயமாக கடைசி நேரத்தில் மெயின் பார்மசிஸ்ட், அதாவது எங்களை பிரதிய பார்மசிஸ்டால வந்து அது சைன் பண்ணி கொடுக்க வேண்டும் என்பதையும் கட்டாயப்படுத்தியிருக்கின்றார்கள். கடைசியாக சொன்ன விஷயங்கள் தான், அதாவது கடைசியாக நாங்கள் மெடிசனை கொடுக்கின்ற போது, பேஷண்ட்டுக்கு கொடுக்கின்ற போது நாங்கள் முதலாவது கொடுக்கும்போது அந்த மருந்துக்குரிய அந்த சிட்டுக்குரிய பேஷண்டைய பெயர் சரியான ஆளா என்பதை நாங்கள் கட்டாயம் கண்டுகொள்ள வேண்டும். அதே போன்று அந்த மெடிசின் வந்துட்டு சரியான முறையான மெடிசின் ஒவ்வொரு டெப்லெட்லையும், அதாவது ஒவ்வொரு அந்த கவர்லையும் அந்த மருந்துக்குரிய சகல விடயங்களும் உள்வாங்கப்பட்டிருக்கின்றா என்பதையும் தெளிவான எழுத்துக்கள், தெளிவான கையெழுத்துக்கள் அவர்களுக்கு புரிந்து கொள்ளக்கூடிய மொழிகள் இருக்குமாயின் அது மிகவும் நன்றாக அமையும் என்பதையும் எங்களுக்கு மருத்துவர்கள் வலியுறுத்தி இருக்கின்றார்கள். ஆகவே இவ்வாறான விடயங்களை நாங்கள் கருத்தில் கொள்கின்ற போது ஒரு சிறந்த மருந்து விநியோகிக்கின்றவர்களாக நாங்கள் அடையாளம் காணப்பட்டு எங்களது நோயாளிகளிடமிருந்து நிறைய நன்மைகளை நாங்களும் பெற்றுக்கொள்ள முடியும், அவர்களும் பெற்றுக்கொள்ள முடியும் என்பதே இவ்வாறான இந்த தொகுக்கப்பட்ட இந்த விடயங்களிலிருந்து என்னால் கூறக்கூடிய விஷயங்கள். Thank you very much, madam. I gave all the summaries.
Yeah, Shiraz, over to you. Thank you, Nalin. Shiraz, over to you. Shulani, you can unmute Shiraz.
Thank you, Ms. Riza. Thank you so much, madam, for your valuable insights on the topic of good dispensing practices. So next is the quiz competition, as I explained in the starting of the session. So Sholani, if we can go to the question.
Yeah, wait.
So, and you can send the answers with your contact number to the chat box. And the question is, what is the theme of World Pharmacist Day 2025? Question once again, what is the theme of World Pharmacist Day 2025? So you can send your answers to the chat box with your contact number. I'll repeat the question again. What is the theme of World Pharmacist Day 2025? So we will be checking with the answers, and next to announce the winners of the quiz competition and for the vote of thanks, I invite Mr. Chaminda Kuruppu, Head of Sales and Distribution, Slim Pharmaceuticals Private Limited. So over to you, Mr. Chaminda.
Yeah, we have got already three parties. We have got the first 3 we have got. So, I mean, you can announce the first 3. Taminder?
Yes, Lisa. Yeah.
Yeah, you can announce the first three.
Okay. Right.
Can I announce Taminder if you can't see?
Yeah, please.
Yeah, first one is Imasha Navodya. Please put your contact number. Satsala Vindana Gamage. Please put your contact number. Nuha Akbar. Please put your contact number. All please put the contact number. We will be in touch with you very soon. All the best for you. So Taminder, it's over to you.
Okay, thank you very much. So congratulations for all the three winners, and definitely we will contact you soon. Right. Okay. Now, good evening, everyone. So first of all, I would like to extended my heartfelt gratitude to our esteemed guest speaker, Professor Nitushi Samarnayakar, for sharing her valuable insights and expertise with us today. Madam, your presentations were very informative, engaging, and thought-provoking. Then I would like to thank our attendees, thanking you for participating actively and contributing towards Q&A session. Your enthusiasm and interest made this webinar a success. So finally, thank you all, and we look forward to future webinars. Good night, everyone.
Thank you, madam. Thank you very much, Nitushi, madam. And thank you for all the participants. It was a great session. And thank you all.
Thank you and goodbye.
Thanks, madam. Thank you. Thank you, madam. It was a great session. I